Hello, Dr. Ayush Ghavat this side. So today we will be discussing about insulin and diabetes mellitus. So how decreased functioning of insulin causing diabetes mellitus. So we'll be discussing about that. So for that we need to understand about the pancreas. So pancreas is both exocrine and endocrine gland in our body. So the endocrine function of pancreas, in pancreas there are beta cells which produces insulin. So basically insulin is the hormone. We can say that insulin is a peptide hormone which basically decrease the level of glucose in our blood. Now how insulin is decreasing the level of glucose in our blood, we'll discussing about that. So whenever we eat food, the glucose level in our blood get raised. So after that the pancreas, the beta cells produce insulin, and that insulin is produced. After that the increased level of glucose in our blood get transferred to the cells with the help of insulin. So for the production of energy, the cell takes glucose from the blood with the help of insulin, and energy is produced with the help of glucose. So that is the basic functioning of insulin. And after that the remaining glucose which is not used for making energy, that is stored in the form of glycogen in the liver and the muscles. So this is the normal functioning of insulin. So when this work is not occurred properly, so that causing disturbance, or we can say that this condition causing many damage to our system. And like I will tell you about that. So when insulin is not produced by beta cells properly, or produced less in amount by the beta cells, that condition causes hyperglycemia or diabetes mellitus. Or we can say that the insulin is produced by beta cell properly, but it is not able to work properly. That condition is called as insulin resistance. So just like a risk factor, obesity, or we can say that sedentary lifestyle, not working properly, and stress, anxiety, depressions, etc. These are the major factors or major risk factors which causes insulin resistance. So insulin resistance, just because of insulin resistance, the people can get hyperglycemia or diabetes mellitus. So like when we eat food, the glucose level inside our blood get rises. So with the help of insulin, the adipose tissue, the muscles, the liver get glucose from that blood, and it utilized for making the energy. So when insulin resistance is there, that adipose tissues, that skeletal muscles, liver not able to take that glucose properly, and the glucose in the blood get risen. And also the liver also produces glucose with the help of the process of gluconeogenesis or glyconeogenesis. What is glyconeogenesis? Firstly, I have said that the stored form of glucose in the liver and muscle is called as glycogen. So the glycogenolysis is the process from which the glycogen is converted into the glucose inside the liver. So this process is called as glycogenolysis. So with the help of liver also, the glucose level gets increases in the blood. With the process of glycogenolysis, the glycogen is converted in the glucose. And also the meal from what we eat, after that also the the glucose level is rises in the blood. So both glycogenolysis and food we eat causes hyperglycemia. So that the rise of sugar in the blood with both the processes causes hyperglycemia. And the what we can say, the for the long term, the glycemic condition is called as diabetes mellitus. So this is diabetes mellitus, and there are like short term and long term complication of diabetes mellitus. Basically, short term complications are infection in the bloods, and the long term complication are the what we can say, the damaging of blood vessels. Like for an example, the blood vessels which are traveling to the eyes, it get damaged. When it get damaged, it causes retinopathy, or we can say that diabetic retinopathy. So whatever, like the blood vessel which is traveling to the kidney, it causes diabetic nephropathy, or when the blood vessel which is going to the peripheral system, it causes peripheral neuropathy. So this is all about the functioning of insulin and diabetes mellitus, how decreased level of insulin causing diabetes mellitus. So thank you very much, take care, all the best for your future.